There's probably a small bottle in your medicine cabinet, one you reach for without even thinking about it. But behind that simple little painkiller, well, there's a huge story that spans thousands of years, and it's all about this fascinating biological switch that we're still trying to get just right. So today, we're going to pull back the curtain and unlock the secrets of what we call NSAIDs.
Okay, seriously, just picture your medicine cabinet right now. I'm willing to bet that somewhere behind the Band-Aids and the allergy meds, there's a bottle you know really well. Maybe some ibuprofen, naproxen, or even some good old aspirin.
Yeah, if any of those names ring a bell, then what you're looking at is something called an NSAID. It's just a simple acronym for this huge class of drugs that they're everywhere. We're talking about something that helps billions of people deal with pain and inflammation every single year.
So what does that weird acronym even stand for? NSAID. It means non-steroidal anti-inflammatory drug. The really important words there are non-steroidal. It means they fight all that pain and swelling, but without bringing in the big guns, the heavy-duty stuff like steroids. They are truly the workhorses of pain relief. But to really get it, we've got to take a trip way, way back in time.
Yeah, this story gets its start thousands of years ago, long before you could just pop down to the corner pharmacy. And the journey it's incredible. It all begins more than 3,500 years ago. You've got ancient Egyptians chewing on willow bark to help with pain. And for literally thousands of years, that was about as good as it got. Then, boom, a huge leap forward in 1897. A chemist at Bayer, Felix Hoffmann, figures out how to synthesize the active ingredient. He creates acetylsalicylic acid, which, we just call aspirin. But here's the crazy part. For decades, nobody really knew how it worked. That mystery wasn't cracked until 1971 by Sir John Vane. His discovery of the mechanism was so huge, it won him a Nobel Prize and basically kicked open the door for all the modern NSAIDs we use today.
And that discovery, that big aha moment, is exactly what we're going to dive into right now. Because honestly, understanding how these things work is the only way to use them safely and, get the most out of them.
Okay, so here's the absolute heart of the matter. NSAIDs work by blocking these little things in your body called enzymes. The ones we're talking about are called cyclooxygenase, which is a mouthful, so everyone just calls them COX enzymes. But, and this is important, it turns out not all COX enzymes are the same.
See, your body has two main types, and you really got to understand the difference. On one hand, you've got COX-1. Think of it as the housekeeper. It's always on, 24/7, quietly doing all the important background work, like protecting your stomach lining and making sure your kidneys are working right. Then on the other hand, you've got COX-2. This is the alarm system. It's usually off, but it flips on the second you get hurt. And its job is to create pain and swelling to basically scream, hey, pay attention, something's wrong over here.
So let's walk through it. Imagine you twist your ankle. Bam! Instantly, that COX-2 alarm system kicks into high gear, flooding the area with signals that you feel as that awful throbbing pain. Now, when you pop an NSAID, it's basically like a technician showing up and cutting the power cord to that alarm system. It blocks the COX enzymes, and the result? The pain and swelling signals just fade away. Sound perfect, right? Well, there's a catch.
And here's the problem. Most of the common NSAIDs, think ibuprofen, they're not very selective. They shut down that blaring COX-2 alarm system, which is great, but they also shut down the quiet, helpful COX-1 housekeeper. And turning off that protective housekeeper enzyme, well, that's where all the trouble, all the side effects can begin.
But first, let's talk about the good stuff, because there's a reason these drugs are in almost every home. They are fantastic for that inflammatory kind of pain, like arthritis. They work super fast, they're an amazing non-opioid choice for things like sprains or headaches, and of course, they're great at bringing down a fever.
Okay, but here's the flip side. Remember how they can shut down that COX-1 housekeeper? That's the issue. Without that housekeeper on duty, your stomach lining is left unprotected, which can lead to everything from an upset stomach to ulcers. It can also mess with your kidneys and, this is a big one, it can actually increase your risk for serious heart problems like heart attacks and strokes.
So with all that in mind, how on earth do you make a smart choice? It is so clear that this isn't a one-size-fits-all kind of deal. So let's get practical and break down how you can choose wisely. Okay, this little chart here is super helpful because it shows you the different personalities of these drugs. You've got ibuprofen, which is kind of the go-to, short-acting general first choice. Then there's naproxen. It lasts longer, which is nice, and it's often the one doctors lean towards for folks with heart health concerns. And then you get to these guys, meloxicam and especially celecoxib. Now they're different.
They were engineered to be smarter, to selectively go after that COX-2 alarm system while trying to leave the COX-1 housekeeper alone. And that makes them way, way gentler on your stomach.
Which of course leads to the one question everybody has. All right, so which one is the best? Is there, like, a clear winner here?
And the answer, honestly, is a big, fat no. There is absolutely no single best NSAID for everybody. The right one for you depends completely on your personal health risks. It's all about that balancing act.
So let's play out a couple of what-if scenarios. Okay, what if you have a sensitive stomach? Or maybe you've even had ulcers in the past? Well, in that case, something like celecoxib is probably going to be your best bet. Remember, it's designed to target that COX-2 alarm specifically, which means it offers much, much better protection for your stomach.
All right, but what about the other big risk factor we talked about? What if your main concern is your heart health?
In that situation, the conversation usually turns to naproxen. Look, no NSAID is totally without risk, but naproxen is generally seen as one of the safer choices for your heart. Part of the reason is that its effect on your blood is a bit more steady and predictable, almost like a very, very low-dose aspirin.
But you know what? No matter which one you and your doctor decide on, there is one golden rule that applies to all of them. Seriously, if you remember nothing else from this, remember this: use the lowest effective dose for the shortest possible time. That is the absolute key to getting all the benefits while keeping the risks as low as you possibly can.
So the next time you reach into that medicine cabinet for a headache or a sore muscle, maybe you'll look at that little bottle a bit differently. You'll see it not just as a pill, but as this tiny piece of really smart technology with an incredible history that's designed to do a very specific job inside your body. I really hope this helps you use them more wisely. Thanks for tuning in.